screen. Hello, I'm Dr. Sandra Cabot. Welcome to my webinars, where I share information to give you knowledge and clarity to enhance your health and well-being. I've been a medical doctor for over 50 years, and I know that knowledge is power. So let's go. Hello, everybody.
Hi, Sandra. How you doing?
Hello, Igor. It's great to see you. And it's fantastic to talk about our topic today, which is how to optimize your brain. And, there's a lot of people out there suffering with mood disorder, foggy brain, where you just don't have that quick thinking anymore. You can't focus. You just feel behind the eight ball. So we're going to look at how you can improve your brain. We used to think that the brain couldn't be changed, didn't we, Igor?
Yeah, now we know about neuroplasticity.
Exactly. We can grow new networks in our brain, and we can repair brain cells and get them working again properly, and we can actually grow new networks. So that repair, it can be very substantial. And I see so many people who have problems with foggy brain, and they worry that they're going to get dementia, which is fair enough, because dementia is now the leading cause of death in women in some countries in the world.
Wow.
Yeah, it is. And this is a new phenomena, it's right up there. In some countries, it's the second leading cause of death, and in others, it's the number one leading cause of death. And there's a lot of reasons for this, but the message really is that most cases of dementia are preventable. So that's good news, isn't it?
Why does it afflict women more than men?
Probably because of the hormonal changes. After menopause, women lose their sex hormones, and also women are more susceptible to damage from alcohol than men are.
Right.
Yeah. And stress. I think, a lot of women have more stress because they're the carers. But it's really worth trying to optimize your brain, because that's going to improve your memory, your mood, and it's also going to reduce your risk of dementia. So the brain is such a fascinating organ. It really is amazing that in a piece of brain tissue that is only the size of 1 grain of sand, there are 100,000 brain cells.
Wow.
Blowing. That is mind-blowing, isn't it?
There's like a statistic that there's something like as many neurons in the brain as there are stars that we know of, 100 billion or something like that.
Yes. Well, there's billions, yeah. And there's trillions of synapses. So, if you get a piece of your brain the size of 1 grain of sand, there should be around 100,000 neurons and 1 billion synapses. 1 billion. So, you're pretty smart, right?
Hard to grasp.
Yeah, I mean, people don't realize just how amazing their brain is, how smart they are. And of course, we're looking at AI. We're trying to get AI to simulate all these networks. But it's just overwhelming how that could ever be achieved. So our neurons support everything we do, everything. Our thoughts, our emotions, our sleep, our movement. And so, that's something that we want to protect. We really do. And it's incredible that, our brain doesn't weigh that much. Like, it's only about 2% of the total weight of our body, but it uses around 20% of the energy. Yeah. So it's metabolically extremely active compared to the other cells in your body. Yeah. And, your brain is really just a jelly-like organ. It's wobbly jelly, and it's largely composed of fat and water. So if you remove the water from your brain, what's left, or 60% of the tissue that's left, is fat. So if you go up to your best friend and say, "Listen, fathead, stop annoying me," you're actually complimenting them. Because the more fat in your brain, the smarter you are. So you're definitely a fathead, Igor.
Thanks. I love a good backhand compliment.
And what types of fat? What types of fat do you think are in your brain, Igor?
I presume the type that they've been trying to get us to stop eating over the past 50 years, cholesterol.
Yes, cholesterol. There's lots of cholesterol in your brain, and if you don't have enough cholesterol in your brain, it's not going to work properly. So I'm not a believer in really low cholesterol levels.
Yeah.
And it's interesting, when I started medicine a long time ago, in the early 70s, the upper limit of the normal range for cholesterol was 6.5. That was considered okay. And now it's 5.5. So they've shifted the bell curve, of the normal range. And, you see people who have been told they have to get their cholesterol down to 3.
Wow.
Well, I don't think that's good for your brain.
No. Maybe we're easier to control when we've got less brain matter.
Yeah. And, there are books out there about the side effects of cholesterol-lowering drugs. I've written one called Cholesterol, the Real Truth, and that talks about, all the alternative things you can do to get the right balance of cholesterol in your body, which is good for your arteries. And there was a book written by an American astronaut called Dr. Graveline. He was an American astronaut, and he was prescribed a statin drug called Lipitor. And he couldn't remember anything after a few months, and so he got off the drug, and then he wrote a book called Lipitor, the Thief of Memory.
Yeah.
So if it can reduce the memory of an astronaut, imagine what it does to just a regular person.
Well, I mean,
So
I remember doing a bit of a deep dive those original studies that were the basis of those dietary guidelines, and the new and sort of what we would now consider the upside down food pyramid, which was the food pyramid for a long time. And a lot of those studies were actually financed by big processed food and big sugar.
Yeah, that's right. So everybody thought, the best way to lose weight is to go low fat. No, it's not. It's to go low carb. So, yeah, your brain loves fat. So you want to be a fathead, right? You want to get enough fat in your diet so you can be a fathead and we'll be smarter.
More fatheads, the merrier.
So let's look at a healthy brain. You can see that's a cross-section of the brain. And you can see the healthy brain is a bigger, right? The Alzheimer's brain has shrunken So there's a loss of brain cells and a loss of nerve fibers and a loss of fat in the brain. So that side of the brain that's affected by Alzheimer's is kind of shrunken up and dried out. And you can see that the spaces in the brain, which we call the ventricles, are swollen up because there's more space for them to get bigger because there's less brain tissue. So what does cholesterol do in our brain? Well, it forms a lot of the structure in our brain, and in particular, it insulates the nerve pathways. So the nerves are just like, the electrical cords in your house, and they've got to be insulated, otherwise you get short circuits and the flow of electricity is erratic. So if you don't have enough cholesterol in your brain, these insulating sheaths will not be as healthy. We call them the myelin sheath. And these myelin sheaths are what gets damaged in people with multiple sclerosis.
Yeah, right. So that causes the communication signals to scramble.
Exactly. And to slow down so you don't think as fast. So let's talk about where you make your memories. You make your memories in a part of the brain called the hippocampus. I'm sure you've heard of that. Have you?
I have, yeah.
Yeah. And it's not a huge structure, but it's got a lot of neurons. It's very densely populated with brain cells. And it's embedded deep in the temporal lobes. So the temporal lobes are deep in this part of your brain. And it's very deep, but we can see it on an MRI scan. So that's where you turn experiences into memories. So new learning is stored there. And so you want your hippocampus to be really, really healthy. And the hippocampus is one of the few places in the brain where you can grow new neurons and you can grow new networks. Yeah. And it's interesting that the hippocampus is high in the mineral zinc. So you don't want to be low in zinc, right? If you want to be a super brain.
Yeah, you got to remember to take your zinc supplements.
Yeah, and eat unprocessed food that is high in zinc.
Whereas oysters, I think, are the highest, aren't they?
Yeah.
Yeah.
Oysters and meat and nuts. Yeah. So the hippocampus is, so critical. It's where we store new experiences. That's where we learn and we can remember. And it also is very important with our spatial orientation.
Have you heard of a Pixar movie called Inside Out?
No.
Oh, it's great. It actually tries to explain a lot of the major functions of the brain. Number two, they talk about how short-term memories are stored in the long-term memory, and just the way they animate it. I've heard from some podcasts that it's actually fairly accurate. It's really worth checking out. It's good fun, good insight. Yeah.
Yeah, well, memory's so interesting. It's like, if you're trying to remember something from 5 or 6 years ago, you go, oh, I know that person's name, or I know that place, and it just won't come to you straight away. And then after 5 minutes, it comes to you. So you're retrieving that memory from another part of your brain, not from the hippocampus, probably from the cortex, which is, the gray matter. Yeah.
So that's why if I don't know, my brain's really efficient at cleaning out names of people I haven't seen in a while, even to the point where it's embarrassing. Like I'll know someone quite well and I just haven't seen him in a while. I'm like, wait, what's your name? I'll I'll find out, but yeah, it's a bit embarrassing.
It is, but it happens to everyone, and you're young. But yeah, it takes time to retrieve old memories. But people who are getting dementia, it's the short-term memories. They can't remember what they had for breakfast. They can't remember what they said 5 minutes ago. So it's the loss of the short-term memories that really stops you from functioning. That is predominant in dementia. So let's go on.
A documentary how they were able to trigger long-term memories in people with dementia by playing songs that they loved during their formative years.
Yes.
So they'll actually remember the words to those songs and they'll have a dance.
Yes.
Yeah.
That's right. Yeah. So, what are some of the things that could damage your brain? The risk factors. Well, we talked about fat. Are you getting enough fat in your diet? Now, the most important fat of all is omega-3 fatty acids. So this is why oily fish is so good. And the omega-3s are the EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, and ALA. And those omega-3s are concentrated in the part of the neuron where communication between neurons occurs, in the synapse, where the neurons talk to each other. So very, very important for neurons to communicate. So it's good, if you can eat things like salmon, tuna, sardines, herring, cod, and even canned fish is good, like wild Alaskan salmon. And I find in Australia the barramundi is quite good too. Yeah, it's quite oily.
Mackerel.
So mackerel, yeah, that's another one. Yeah. And you should really eat fish about 2 or 3 times a week, I think, to get enough omega-3. Some people supplement with fish oil, but always buy an expensive, good quality fish oil. Don't buy the bargain special, 500 capsules for $20, because it's not going to be good quality. But I think the best thing is to eat the fish.
And if it's bad quality, does that mean it's less bioavailable?
No, it means it's not fresh. Omega-3 fats go rancid very quickly.
Right.
If they're not fresh. That's why it's good to eat the fish. Now, if you're a vegan, it is much harder to get the EPA and the DHA. I mean, you can get the other type of omega-3 called ALA from plant foods such as nuts and seeds, like hemp and chia, linseed, edamame beans, kidney beans, walnuts, seaweed, algae. But the ALA is not as quickly utilized by your brain, because your body has to convert the ALA into the EPA and the DHA. And as you get older, you may not be so efficient at that. There you go. So if you're a vegan, if you don't take a fish oil supplement, you're probably going to really need to bump up these plant sources of ALA. Now, the other fats that are good for your brain are the monounsaturated fats found in the fatty parts of red meat and chicken, so eat the skin, and also in nuts and high-fat fruits like olives and avocados. So once again, you're looking at, make sure you're eating fat. Your brain is going to be very thankful for that. And it won't put on weight. It won't. So don't get paranoid about that. Now, the other thing, this is a funny little cartoon. This is a good way to get your vitamin D and exercise at one time.
Nude bike riding.
Yeah. Well, if you have got a bit of a memory deficit, you won't even realize that you've forgotten to put your clothes on.
You forget about the weird looks you're getting from people.
But we know that exercise is critical to prevent dementia, and it reduces your risk of dementia a lot if you exercise regularly. Even just a brisk walking, but anything you can do. And, the more energetic the exercise, the more aerobic, the better for your brain. Because exercise causes your muscles to produce a protein called BDNF, called brain-derived neurotrophic factor, BDNF, and that goes to your brain and it stimulates the growth of new networks between your neurons. So exercise is critical, and I think that one of the reasons that dementia is becoming such a huge problem in this day and age is because people are not so active. They get up in the morning, they're rushed, they've got to get to work, they sit in the car for an hour, then they get in the office, they sit down all day, and then they drive home for an hour, and then they're tired. So our lifestyle is very toxic for our brain. So we've got to think of ways to exercise. One of the ladies in our office, she's got a desk treadmill. So she'll be working on the computer and she's walking on her little treadmill while she's working. And, for some people that works quite well for them. But otherwise, you want to get up and have, do some exercise every hour, some stretching, go for a 10-minute walk. Anything you can do. I think exercise is so critical.
Definitely.
And this is what you can do if you stay physically fit. See, that's what I can do, Igor.
Wow. I believe it when I see it.
Actually, I haven't tried that. I better try it.
Yeah.
But yeah, like that lady must be 90 and she's doing great, right?
Wow. I saw a video of this guy in Siberia. It was like in his 80s, and he's like climbing up between these two rock faces, something like 10 meters in the air.
Wow.
So I actually remember I was volunteering in the Amazon like 10 years ago, something like that, and there was one of the local Peruvian guides was taking us to a certain endangered plant. There was a bunch of seedlings of a certain plant that we're trying to replant.
Yeah.
And he just had his machete. He had a cigarette in one hand, machete in the other, and he was in his 70s. And he was just like plowing through the jungle, just cutting, slicing through like so fast, and just climbing up the mountain like a mountain goat. And we're all like in our 20s, and we're all like out of breath, struggling to keep up with him. He's like, "Come on, guys, what are you guys holding me up for?"
Yeah. Well, I've got a colleague who's 82 and he's a pilot. Sometimes we fly together because I'm a pilot. And he plays A-grade tennis. He's 82. He's still an active pilot. And he eats a lot of fish. A lot. And, it's amazing. Some people in their 80s, they act like someone in their 30s and 40s. It's a state of mind, isn't it? You got to think young. You got to eat right for your brain, and you got to stay physically active. Yeah.
I wonder if they have less dementia in Japan because fish is a big part of their diet.
Definitely. Yes. So what are some of the other risk factors for brain decline? Infections. And particularly infections that are chronic. And they may be hidden in your body, you're not even aware of them. Now, one virus that infects 99% of human beings is the herpes virus. There's 8 different types of herpes virus that infect human beings. So if you did a blood test on everybody out there, they're all going to show up that in the past they've had the herpes virus. And of course, we know that chickenpox is the herpes virus, but there's other types. There's when it reactivates, it becomes shingles. Then there's a herpes type 1, which can cause cold sores. So people who get a lot of herpes, particularly in their face, so they might get shingles in the face, or they get a lot of cold sores, or particularly if they get herpes up their nose, that is a risk factor for the brain, because that virus loves nerve tissue and it can get into your brain and cause damage. And they have found herpes simplex virus DNA inside the brains of people with dementia when they've done autopsies. So, if you're getting a lot of herpes, you need to look at what you can do to reduce that infection. And we do have drugs that reduce that, antiviral drugs. But another way that works really well is to bump up your intake of the mineral selenium, because selenium is like the antiviral birth control pill. And I've had patients who've had herpes in their vagus nerve, and they've also had cold sores and shingles and whatever, and I've given them selenium and it's cured them. So selenium deficiency could be a reason why you're getting a lot of herpes. Also, the mineral zinc can reduce it, and also if you're low in vitamin D. So people during the winter in cold climates, they may get outbreaks of herpes because they're low in vitamin D.
And is that because it weakens the immune system?
Yes. Yeah, vitamin D is antiviral. So is selenium. So is zinc, and so is vitamin C. So people think they have a healthy diet. Yeah, but you may not be absorbing the minerals if you have a gut problem, or the soils may be low in these minerals. It's common. And you may find that when you use a therapeutic dose of these things, that you can control these infections. The recommended daily allowance is the bare minimum. So some people will find that they use a higher dose as a supplement, it really works for them. The RDA doesn't. Okay, other infections that are particularly dangerous for the brain are bacteria known as spirochete bacteria. Have you heard of those, Igor?
Never heard of it.
No. Well, spirochete bacteria are named so because they can spiral. They're shaped like a spiral, and they can spiral their way deeply into your tissues, including the brain.
Sounds
So
horrific.
we've got it's interesting. We've got that was scary. We've got the blood-brain barrier, right? So the barrier around the brain that prevents nasty things from our blood getting into the brain. But these spirochete bacteria can spiral their way through the blood-brain barrier. So the most common spirochete bacteria that we see are syphilis, and that's still very common. It's a common infection. Lyme disease and gum disease, the bacteria that cause gum disease. So if you do have gum disease, you really want to control it. Probably the best way to do that is by taking N-acetylcysteine.
And that's the NAC. Oh, NAC.
NAC is very good for chronic gum disease. And also bump up your vitamin C. You might need 1,000 or 2,000 milligrams a day. And look at your diet. Obviously eating the wrong things, causing the wrong bacteria in your mouth. And also, after you eat, brush your teeth straight away, and then you can do the oil pulling with the coconut oil. That helps to draw the toxins out of the gums, and it also has an antibacterial effect, coconut oil.
So what's that? You just put some coconut oil in your mouth and you splash it around like a mouthwash?
Yeah. So you get a tablespoon of coconut oil and you put it in your mouth and you keep it there for 15 to 20 minutes and you swish it around.
20 minutes?
Yeah.
That's a long time.
It's a good way to stop somebody talking. My sister does it regularly.
Okay.
I've learned to understand what she's saying when her mouth's full of coconut oil.
Oh, so she still tries to communicate.
She does. We call it the cocoa language.
Cocoa language. That's crazier than a coconut.
She's quite funny, my sister, Madeline. Yeah.
Right.
So the coconut oil pulling, and so you keep it in your mouth, swill it around, swish it around, and then spit it out in the bin. So Lyme disease, well, we have antibiotics for that. So that comes from ticks, the bacteria that ticks introduce into your body. And syphilis, well, that's all about having safe sex. Syphilis can cause terrible dementia because it gets into the frontal temporal lobes and it destroys your brain.
Wow.
Yeah, so sex can be very dangerous, you know.
Yeah.
You want to have safe sex.
Yeah.
Yeah.
Who would have thought like one slip up when you're young can actually impact you when you're old?
Yeah, well, syphilis usually presents with a sore on the genital area, just a sore. We call it a chancre. And then 6 weeks later, you get a widespread rash. And then if it's not treated with penicillin or another suitable antibiotic, 20 years later, you'll get severe dementia.
Wow.
So it's good to have a blood test of syphilis if you've got a rash. Yeah.
Just regular testing is, I think, good for everyone.
Yeah, definitely. So we know that chronic infection contributes to the type of brain damage seen in dementia. There's strong evidence of infectious microbes in the brain from viruses. And we mentioned the herpes virus. I think that's the most dangerous one. But even the coronavirus, you know, that can get into your brain. Bacteria and fungi. And even some parasites. Like there's some worms that get their way into the brain. So, in other words, good hygiene is very, very important. Always wash your hands a lot. And, you know, have a feces test for parasites if you don't feel well and you don't know why, because there are parasites that can damage the brain.
Meningitis, that's the one that can put you in a wheelchair or kill you, isn't it? I almost got meningitis once upon a time.
Yes,
yeah,
that's right. Well, we have a vaccine for that, which is helpful.
Okay.
But yeah, I've worked in India in a missionary hospital in the 1980s, and I saw a lot of children die from meningitis.
That's terrible.
Yeah, so I think that meningitis vaccine is worthwhile. But basically, you know, meningitis is where the bacteria or the virus gets into the covering around the brain, and then it gets into the bloodstream and it causes clotting. And so it can cause strokes, it can cause convulsions, it can cause loss of limbs. And early diagnosis is the key. You know, if you've got a severe headache, a fever, stiff neck, you want to get to hospital very quickly and have a blood test, a blood culture, because we can save your life, with antibiotics. Yeah. Another risk factor is your circulation. So we're looking at the risk factors today because, you know, talking about the brain is a huge subject. So we're going to break it up into segments. We'll probably do 3 different segments on optimizing the brain. And I know, Igor, you'll talk about how our thoughts and emotions if they're very negative, can actually change the physical structure of the brain. And I know that's your area. But I think, we really will need to break this up into several presentations, don't you?
I think so, yeah.
Yeah.
You've obviously got quite a bit to get through, and I can sort of talk about that stuff later down the track.
Yeah. So poor circulation of blood to the brain. So, the brain has a huge requirement for fresh, oxygenated arterial blood. So if you look at all the blood vessels in the brain and you stretch them out, they'll be about 100,000 miles long.
Wow.
Yeah, it's got a huge network of arteries. So the large arteries to the brain, like the carotid arteries, which are here in the neck, they can become blocked with plaque. So if somebody has got, brain symptoms, neurological symptoms, we do an ultrasound of the carotid arteries and we can see if there's any blockage in the carotid arteries. But what we see more commonly is damage to the small blood vessels in the brain. The small arteries, the small capillaries. And we call this cerebral small vessel disease, abbreviated to CSVD, small vessel disease. And this is quite common. So this can cause dementia. So this is different to Alzheimer's, right? This is caused by circulation of blood not being adequate. It's quite common. And in the early stages, it can present just as mood disturbance, depression, anxiety, dizziness. And then if it's not treated, it can result in mini strokes. You get these little mini strokes. We call them transient ischemic attacks. So you may just have vertigo, a temporary loss of vision or double vision, a loss of memory, but, after a few hours, it comes back. You're okay. So what we do is an MRI scan, a magnetic resonance imaging scan, MRI, and we will be able to see the damage to these small blood vessels in the brain. And they show up as little white spots in the MRI scan. We call them white matter hyperintensities. And I recently had a patient with this. She was 72, and for about 3 or 4 years, she had been getting mentally foggy. She'd be talking away and she'd lose her train of thought, and then she'd go off on a tangent. And she had dizzy spells, mood disorder, and so I did an MRI and she had all these little white spots. And she did have some brain shrinkage. So, if your brain is not getting enough blood, it's not getting enough oxygen. So if it's not getting enough oxygen, the brain cells cannot make energy in the mitochondria. So brain cells have lots of mitochondria. They have thousands and thousands of mitochondria in each brain cell. So if those mitochondria are not getting oxygen, they can't make energy from glucose. So your brain cell will not be able to make neurotransmitters. So that's why your thinking slows down. Everything slows down. So we've got to look after our circulation to the brain. And I think this is why exercise is so critical to preserve our brain mass and function, because it's bringing a better circulation of freshly oxygenated blood to our neurons. So exercise and deep breathing. And some people will even try a hyperbaric oxygen chamber, if they've got this problem. Yeah.
That can help.
Yes. So what it's the cause of the damage to these little blood vessels. Well, I think if you're a very, very sedentary person, if you don't exercise at all, you're not getting that blood flow to your brain. So the tiny little arteries, they're not getting the pressure they need for the blood to flow. So that could cause it. Then also high blood pressure. So high blood pressure is very damaging for your brain. It will damage the arteries and capillaries in your brain, and they will get hard and blocked. So we have to treat high blood pressure. And that is diet, lifestyle, and usually medication, antihypertensive medication. But the most common cause of high blood pressure is insulin resistance, but also it can be genetic. So if you've got a family history of high blood pressure, by the time you're getting past 60, you're probably going to need your blood pressure treated. Diabetes is very damaging to the blood vessels in your brain. And diabetes type 2 has been called diabetes type 3 in the brain because it specifically damages the brain.
Is that because there's too much sugar in the blood because the insulin is not able to remove it? Is that right?
Yeah. So there's plenty of sugar in the blood. There's too much, but it can't get into the brain cells. So the brain cells are starving to death. You know, the sugar is staying in your blood and it's causing damage there, but it can't get into the brain cells. So the brain cells can't make energy. And so your brain is starving to death. So diabetes is very damaging to your blood vessels because that extra sugar in your blood is sticky. Sugar's sticky. So it sticks to the lining of the blood vessels, causes inflammation and plaque, and it blocks the blood vessels. So we've got to control diabetes. The best way is exercise and a low-carb diet. High protein, high fat diet is good. And, you know, that we do have medications that can help. And there's also supplements that can help. And we'll be talking about that and further segments on the brain. And then sleep apnea. It will cause damage to the blood vessels in your brain. And so if you are a poor sleeper, you may be overweight, you may snore badly, you need to go to a sleep laboratory and be checked for sleep apnea, because that's a big risk factor for dementia. And if you wake up in the morning and feel really terrible, really exhausted, like you haven't had a refreshing sleep, that's a sign you could have sleep apnea. So get it checked out. The other thing that damages your blood vessels in the brain is smoking. So we're going to look after those blood vessels. Yeah.
Which can also lead to gum disease as well. And we talked about gum disease can actually introduce parasites into the brain.
Well, the gums, if they're diseased, they have the spirochete bacteria.
Which can
spiral their way into the brain. But parasites are more in the gut, you know, like worms. Worms are the particularly nasty ones. It's not common for, you know, parasites in the gut to get into the brain, but it does happen. That's why I say always wash your hands and always cook your food. If you're eating meat, always cook it well.
Definitely.
So you can see the huge amount of blood vessels supplying the brain.
Wow.
Yeah. Has a continual need for blood. I mean, you think about it, like, let's say you're in an aeroplane at 40,000 feet and it depressurizes. So there's no oxygen in the air, right? How long does it take for you to lose consciousness?
Was it 3 minutes?
No, 10 seconds.
10 seconds. Wow.
10 to 15 seconds, you'll be completely unconscious.
Wow.
So the brain cannot cope without oxygen, which is why the blood vessel supply is critical.
So if that happens, then you won't be there for the impact anyway. So
well, hopefully the oxygen mask will come down, and then when you get to a lower level, you'll wake up and you'll put it on.
Oh yeah. That's
Now,
ideal.
I think, did you have a presentation? Did you want to present some slides?
Not today. No, I've just had some. I was gonna work on it today, but I've one of my best friends in hospital, so I've just been trying to help him, and just been a bit distracted. But I can talk about it next time, so that's fine.
Yeah, how negative thoughts and negative emotions can affect the biochemistry of the brain and even the neural pathways, how we're hardwired, I think.
Yeah, they say that 80% of our thoughts are negative.
That much?
Yeah, on average. I have to double check that, but that's what I've been told by a few people.
Yeah, that's right. Well, I think negative thoughts create anxiety, and then anxiety creates brain inflammation, and that can be damaging for your neurons. So I think your state of mind has a lot to do with your likelihood to get dementia. And thinking positive is also going to give you hope, so that, you are going to then have an exercise program. You are going to follow a healthy diet. I had one patient who I'll never forget. She was an older lady, a lovely lady. She was in her 80s, and she came to me and she said, "Oh, Dr. Cabot, I think I'm getting dementia. I'm losing my memory and I'm petrified." And then I took her dietary history, and basically she just lived on cups of tea and toast, butter and jam, but at least the butter was healthy.
That's it. There's no diversity in that diet at all.
No. Well, she didn't have very good teeth, right? Which is common in older people. So I said to her, well, you're really low in folic acid. So without folic acid, you're not going to be able to make neurotransmitters like acetylcholine, which is the neurotransmitter of memory, or serotonin for mood. I said, you need to get a good juice extractor. So we had a juicing the rainbow, all the green stuff, purple stuff, orange stuff, red stuff, citrus. And so she did that, and she came back 3 months later and she said, my memory's better than it was in my 40s. So that's just the folic acid.
There you go.
So, she was stuck in this negative state of mind, like this was inevitable. And that negative thought had perpetuated that she couldn't do anything, so she kept getting worse. So, you got to get the antioxidants into you, and folic acid is critical, and vitamin C. And then another patient, she was interesting. She had high blood pressure, and it was really high, right? There was about 250 on 130, very dangerous. And that was present even though she was taking 5 different antihypertensive drugs. So they weren't working. And the reason was she had a fatty liver and she was overweight, but she was stressed out of her brain. And so she said, oh, I can't remember anything. And I said, well, you're on 5 different medications and they're all interacting, and it's disturbing your brain chemistry. And you've got so much inflammation that your brain is not making neurotransmitters. So what I did is I sent her to a health retreat and I got her to go on a detox and to do juicing there and yoga, and to get away from the stress, stop thinking about it, and to go on a low-carb diet. And I reduced her blood pressure medication a lot. I removed about 3 of the drugs. And she came back a month later, and her blood pressure was safe, at safe levels, and her memory was pretty good. So, it's all those factors together, the stress, the poor diet, the fatty liver, that gets together and, creates a storm, a perfect storm. So you really have to think, is it worth it? Your health is everything. Just change the situation. And looking after your brain is so important.
And these are all things
Now,
within
we
our.
do have a few people here. We've got Joanne. She's asking about, what about high aldosterone? Well, Joanne, aldosterone is a hormone made by the adrenal glands, and it controls the level of sodium, potassium in your blood. And if your aldosterone's too high, that can cause high blood pressure. Now, if the blood pressure is very hard to control, and your aldosterone is high, you need to take a medication called spironolactone, and it works beautifully. It'll lower the aldosterone, and also do some juicing, increase your potassium. So do some vegetable juicing and take magnesium. Magnesium is critical for people with high blood pressure. We've also got another question. Can we listen to this another time? You want to explain that?
Yeah,
Igor?
I've already answered in the chat, but yeah, basically, all of these episodes are automatically recorded and uploaded to Sandra's Facebook page as well as her YouTube channel. So if you want to watch it or listen to it in future, then yeah, jump on her Facebook page or YouTube channel. And on the YouTube channel, it's under live. So if you click live, you'll be able to see all the episodes there. Facebook, you just have to scroll through the post and you'll find it.
Yeah.
Yep.
I know. Well, look, we're going to do several segments on the brain. The brain is just so fascinating, and you can improve improve your brain so much. Like, I'm doing a lot of case history today, but they're so inspiring. Another patient, she'd been depressed for 20 years, and she had a past history of drug addiction, very low self-esteem, poor diet and lifestyle. And then one day she realized a lot of it was coming from her gut. So she decided to go on the GAPS diet, pretty much, with high-fat bone broth, grass-fed ghee, chicken, high protein, and some vegetables. But a lot more fat in the diet, right? The grass-fed ghee, the avocados. And amazingly, after 3 to 4 months, she was no longer depressed.
Wow.
And that's incredible, isn't it?
Just healed her gut. Because that's what is it, like 80% of our serotonin and dopamine is produced in the gut?
Yes.
Something like that, yeah.
Yes, it is. So, the gut-brain connection is huge. If you've got the wrong gut microbiome, if you've got a leaky gut, you've got gut inflammation and inflammation in the vagus nerve, then that gut-brain connection is very dysfunctional. But also, when she started eating a lot of fat, she was feeding her brain. She was growing new pathways in her brain. So, it really impressed me that so many people out there don't eat enough fat. They don't eat enough protein. They're eating all this carbs. They're eating processed food that's full of omega-6 fatty acids and trans fats, and their brain just can't use it. These fats are the wrong shape.
Yeah, and they cause inflammation as well, don't they?
Yeah, they do. So it's amazing what you can achieve. And, even after a couple of months, if you increase the fat and protein in your diet, get a lot more antioxidants through eating the rainbow, brightly coloured fruits and vegetables, and cut out the junk food, you can get an improvement in your memory within 8 weeks. There's studies that show this. The brain does react very quickly
Mm.
in a good way.
And green tea is a big one as well, isn't it?
Yes, I think so.
Mm.
Green tea is very good for the brain, and coffee's okay too. Isn't that good? Good
Yeah.
news. Just don't put sugar in it. Yeah, that's right. So
We got another question from
we got another
Glenn.
question. Yeah.
Yeah.
What is the best supplements for brain? We're going to cover that. We're going to do several presentations on the brain. If you have an underactive thyroid, Joanne, that's easily treated with thyroid hormone. And you know, the thyroid is so important for your brain. And one of the symptoms of an underactive thyroid is a slow brain, because the thyroid hormone stimulates the mitochondria in your brain, and then you've got enough energy in the brain cells to make neurotransmitters. And you know, I've seen patients over the years who've had undiagnosed thyroid problem, a very underactive thyroid, and they've had it for years and years, and they've slowly deteriorated mentally. And if you give them the thyroid hormone, plus you give them some iodine and some selenium and some zinc, they get better so quickly, their brain wakes up. So if you've got an underactive thyroid, it is good to take the iodine, selenium, zinc, as well as your thyroid hormone. Yeah. And somebody's asked about water. Yes. Good question. Well, your brain is 75% water, so it's a no-brainer. Excuse the pun. You need to drink water. And the vegetable juices are good as well. Herbal teas are good. You know, there's calming herbal teas for your brain, like chamomile. Dandelion is very good for your liver, so that's going to be good for your brain. Yeah, there's so much we can do for our brain, just those little daily habits. I know for me, I'm eating more fish and I'm taking more iodine. I take smoky kelp powders, giving me more iodine. And I think my brain is improved. And I'm in my mid-70s, so it's never too late.
We got two last ones.
Okay. Here's somebody who is on medications for 20 years, but what medication she doesn't specify.
Oh, you're reading the other one. Okay. Oh, this one.
Yeah. Well, I'm working on being a psychic, but I'm not there yet. You need to tell me what medications.
What about this one? What supplement do you recommend for someone with autism? That's a big question.
Okay. Now, children with autism, always check if they're iodine deficient. So you do a urine test, and that will show you the concentration of iodine in the urine. If it's low, give them iodine. There is a very good supplement called Child's Immune Strength Powder, and it tastes delicious, and it's got all your minerals, plus elderberry. It's got iodine, selenium, zinc, and vitamin C. So kids love that as a source of nutrients, child's immune strength. But also get some kelp powder. Like you can get a smoky Tasmanian kelp powder or get an organic one from a safe country and use the kelp powder in the cooking. Iodine is critical for the brain, and so many children are low in iodine, and that will impair their cognition. Also, diet is very, very important. You know, we've got to get children eating more fat and protein and less processed food, and that's not that easy, is it?
It's
You
hard.
know, you have to be sneaky. Yeah,
Mm.
you have to be sneaky and get it into them. Yeah. All right. So there you go. I think we better wind it up here because, you know, it's such a complex subject, but we're going to make it simple and easy for you. And we're going to do a lot more on the brain. We're going to look at how hormones affect your brain, what hormones can help. We're going to look at what supplements can help. We're going to look at sleep, how that affects your brain. And we hope that you join us. Our next presentation on the brain, look at liverdoctor.com and cabothealth.com and sandracabot.com to see when our next presentation on brain will be. And you can always email us. We love to get your emails. Ask us questions and we'll get back to you from liverdoctor.com or sandracabot.com.
Most likely in 2 weeks, so 8th of October. But yeah, we'll confirm.
Yes. Okay, great.
Cool.
Well, thanks, Igor.
That was really interesting.
And thanks, everyone, for listening today.
Thank you.
Well, thanks for being part of our webinar. If you have any questions or new topic suggestions, email us at support@liverdoctor.com. And don't miss our next webinar. Be sure to follow us on social media and subscribe to our newsletter at liverdoctor.com. Bye for now.